Hi, welcome to Nurse Talk with Maggie. I have Neil here with me. Neil, what do you do?
Hi, Maggie. I am a psych nurse, and right now I'm working with the pediatric population.
Okay. How long have you been doing that?
I've been a nurse since 2005, so I'm pushing on 20 years right now.
Oh, wow.
Yeah.
What made you decide psych nursing?
Well, I looked at it as an opportunity to serve the most vulnerable and marginalized patients in our hospital. I think the stigma associated with mental health is a generational problem, and I got into nursing so early, I just figured that would be a good place to be.
Yeah.
Yeah.
Yeah, that's awesome.
Thank you.
So if you don't mind me asking,
Yeah.
how much do you make? How much is the most you've made in a year?
Okay, I think this has been really a hot topic because of all the travel. I haven't been lucky enough to be able to travel, but usually we just get paid on a grid, and it'll either be on between $30 to $60 an hour based on your experience.
Okay.
Yeah.
Okay. So how much is that per year?
So if you hit about 20 years, then you're really maxing out. So at that point, you'll be about 120K a year. Yeah.
So for anyone who wants to be a psych nurse, what would be the advice you would give someone?
I would tell them, my number one advice would be for them not to listen when people tell them that they need to get med surg experience. Psych nurse is a specialty. A lot of people it's really underrated how much you have to work on therapeutic communication and how effective it is. And I think that is a very valuable skill. And low-key, I feel like everybody should do psych nursing for at least 2 years. But that's just me. But yeah, I just say stick with it. If that's what you want to do, definitely follow your passion.
And last question, what is the most memorable experience in psych nursing that you've had?
The first thing that comes to mind was a couple of years ago when I pointed out to our executive leadership that we didn't have adequate homes for people of color or any kind of hair products. And I was actually involved in a process of selecting the combs and picking out vendors. And I thought that was a really impactful experience at the hospital I was working at the time. It was about 2 years ago.
Nice.
Yeah.
Well, thank you so much, Neil.
You're welcome.